What's going on, everybody? This is the review session that I said that I would do for you guys. Uh, gonna go over some things that I highlighted at the end of the class that I didn't necessarily record, but since everybody wasn't there, I probably think it's the best idea to go ahead and give everybody a fair opportunity and kind of know these things. So, just gonna record my screen and periodically I'll type things out. But again, this is coming off of the exam, important things to be aware of. I'm going to try to go through these one by one so you guys will have this for your exam tomorrow. Um, so if this is helpful, give me some feedback. Let me know. Send out an email and let me know that you enjoyed the video or tell me what I can do to make the video better. I'm open to all types of feedback. Um, so appreciate you guys. Let's go ahead and jump in. If I'm describing to you a question, one of the first things that you need to do in order to break the question down is ask, what does he want me to know? What concept is he wanting me to know? Um, so, for example, if I write you out a crazy question and I give a clinical vignette or a clinical question and I'm describing a patient, you don't have to know anything about Addison's disease, or you don't have to know anything about a type of experiment. I want you to figure out the concept that I'm trying to ask you. This is secondary level of thinking. So, for example, if I'm talking about a surgeon taking a biopsy, and then I describe cell types, myelocyte cells with a centrally located nucleus surrounded by a cell membrane. A group of these cells, so a group of cells with this centrally located nucleus, what would you call this specimen? Would this be tissue, cells, organs, or organ systems? Well, we remember that cells come together to form tissue, tissue come together to form organs, and then organs come together to form organ systems. Organ systems come together to form organisms, right? So just based on that knowledge, you would know that tissue would be the right answer, right? Um, Yeah, so it's just finding out the concept that I want you all to know. Of course, knowing that homeostasis, knowing that it's the maintenance of an internal environment. So homeostasis, maintaining a normal internal environment. Remember about this. And the primary means of homeostasis is through what? Negative feedback. What is negative feedback? I'm going to describe negative feedback to you. So you know that within the hypothalamus, we have GnRH. This is within the hypothalamus. And we know that GnRH produces LH and FSH. And where do these occur from? The pituitary. And from here, LH and FSH produce, within the males, they produce what? Testosterone in the testes. So testosterone production itself, the product, will inhibit GnRH and LH production. So this end product here, testosterone, is inhibiting the production of GnRH from the hypothalamus, as well as LH from the pituitary. This is how it shuts down. If your body continued to produce excess testosterone, that necessarily wouldn't be a good thing, right? You would have too much of one thing is never a good thing, right? You would have um, prostate problems. You would have an increase in facial hair growth. You would just be really hairy. Yeah, you might get more muscular, but testosterone has some other negative side effects as well. So I just want you to understand that homeostasis is the maintenance of the internal environment. The primary means of homeostasis is through this negative feedback. And an example of this negative feedback is through, I give you the example here of testosterone. Gonadotropin releasing hormone releases LH and FSH. And then eventually from the pituitary, it comes down to the testes to produce testosterone. And from there, testosterone is going to inhibit gonadotropin releasing hormone at the hypothalamus as well as LH. So if I give you an exam question and I tell you that a 33-year-old male is presenting and he's injecting himself with exogenous testosterone, right? He's injecting himself with testosterone. What would you expect to happen? Well, you know that either one of two answers would be correct on the exam. For example, gonadotropin releasing hormone would be low or luteinizing hormone would be low. So these are just two things. Actually, there's a bunch of concepts. All these are important, but understand negative feedback and its role in homeostasis, understand the definition of homeostasis, and understand how to identify common pathways um, of negative feedback, right? For example, another one. We know that thyroid releasing hormone, TRH, is produced from the hypothalamus. We know it goes down to the pituitary and causes TSH, thyroid stimulating hormone. This is pituitary. Then we know it goes down to the thyroid to cause an increase in T3 and T4. We know that T3 and T4 are going to be, the T4 is going to be the active component, or sorry, T3 is going to be the active component. T4 is going to convert it in the peripheral tissues. We know that this is at the T3 and T4. This is at the thyroid gland itself. So we know, for example, after we have, let's say, for example, someone had a pituitary tumor over secreting TSH, right? Well, this is a tumor, so it's not working well. This means it's over secreting. So you have an increase in this T3 and T4. In a normal person, right, if you were secreting too much thyroid hormone, it would come back and shut itself down at the pituitary and the hypothalamus. This is called negative feedback. In terms of the central dogma, I hope you guys know the central dogma by now, knowing that DNA synthesis occurs first. Then we go on to something called transcription. From transcription, we have translation. And from translation, we have protein synthesis. You guys know this by now. We know from transcription to translation, transcription to translation. This is going to produce messenger RNA. Messenger RNA, this is going to produce RNA. And the RNA itself is then going to go on to be synthesized as proteins within the ribosomes. We talked about exocrine and endocrine functions. Exocrine, glands and ducts. Endocrine, secreted secreted throughout the blood. The main thing here is to know this: glands and ducts. Right? So, for example, if I were to tell you about the pancreas itself, if the pancreas had a duct system, this duct system would be the exocrine portion. And then the alpha cells and the beta cells, which secrete glucagon and insulin, those would be the endocrine portion. Knowing autocrine, endocrine, and paracrine secretions, paracrine are nearby, endocrine's at a distant site, and autocrine means that the hormone has an effect on itself. Knowing that is important. Understanding the difference between steroid and non-steroid hormones. For example, steroid hormones are going to be your estrogen, testosterone, things like that. Diffuse through membranes. They're lipid soluble. Bind to an intracellular receptor. Directly affect gene expression. Whereas non-steroid hormones require secondary messenger. So this makes sense. Non-steroid hormones require a secondary messenger. This often comes in the form of adenylate cyclase. You guys remember that from the practice exam, right? Adenylate cyclase is stimulated. That's an enzyme. Stimulates cyclic AMP, which then goes on to form protein kinase A. One thing I want you to know is just requires a secondary messenger. So if it's not a steroid hormone, if it's not estrogen, testosterone, things that are lipid soluble, then it has to bind to a receptor, binds to a receptor site, and then this receptor site requires a secondary messenger in order to affect expression. This directly affects it. Doesn't require a secondary messenger. Moving on to other hormones, it's important to know where hormones are secreted. Okay, knowing that the posterior pituitary produces what two hormones? ADH, which is antidiuretic hormone, so anti-P. And what's the other one? Oxytocin. So ADH works on the kidneys to conserve water. P. So what happens if we don't produce antidiuretic hormone? Let's say some type of traumatic incident happens, and we don't produce ADH. Well, ADH can't conserve water, which would mean the sodium concentration in the blood would go up, and would mean that your urine is not able to concentrate itself. The main thing to know is that ADH is produced from the posterior pituitary. So if I were to ask you a question, which a patient had a high sodium concentration because they weren't conserving water, because remember that water always follows salt, and the person is peeing out excess and they have very dilute urine, it's not very concentrated, you would know that this is a problem with something going on with ability to conserve water. And you would know that this is ADH's main mechanism of action. And you would know, well, where's ADH produced? Oh, it's a posterior pituitary problem. So posterior pituitary would be the correct answer. If you guys remember the question on the quiz, the woman who was in the motor vehicle accident, she had failure of uterine contractions, wanted to know which of the following structures was most likely affected. It was posterior pituitary. Again, why? Because oxytocin responsible for uterine contractions. Does anybody remember where oxytocin works in order to cause these uterine contractions? Well, think about the layers of the uterus. You've got the endometrium, the myometrium, right? So within the myometrium. Cool. What was important about the endometrium? Over on it, endometrium. 2 layers. Stratum functionalis. Area that sloughed off during menstruation. We have the stratum bassalis. Replaced the stratum functionalis. Cool. I think it's important to be able to tie stuff in. So this should say endometrium. So just going back, posterior pituitary produces ADH and produces oxytocin. Oxytocin works within the myometrium, present within the uterus, in order for uterine contractions to occur. Helps us with childbirth, right? This is the whole reason that we give oxytocin during childbirth, is in order to help the uterus contract in order to deliver the baby. Does that make sense? And just to tie that into reproductive, right? While we're talking about the uterus, we said that the endometrium was important because why? Contained 2 different layers. You had the stratum functionalis and you had the stratum bassalis. So the stratum functionalis was the functional area, which meant that this is the area closest to the endometrium, the area that was responsible for sloughing off during what should be called menstruation here. Apparently, word does not like functionalis. But anyways, stratum bassalis is just the layer that replaces the stratum functionalis. See how all this ties in? We can go from one subject to the next. Because this is the beautiful thing about endocrine and reproductive, is it all goes hand in hand, kind of while I'm testing it together. So all of this is important. Moving on, let's see. So knowing the posterior pituitary, now we'll talk about anterior pituitary. hormones, anterior pituitary hormones. So I showed you the mnemonic flat egg. For F is FSH, L is LH, A is ACTH, the P is prolactin, the E is it stands for endorphins, but we'll just leave the E out, and then G is growth hormone. So these are all controlled by what? The anterior pituitary is all controlled by releasing hormones. So gonadotropin releasing hormone is going to control FSH and LH. ACTH is controlled by CRH, corticotropin releasing hormone. Prolactin, don't worry about that one. And growth hormone is growth hormone releasing hormone. FSH, depending on whether it's male or female, will have different functions. Within the males, we'll talk about males first. Within males, it'll stimulate spermatogenesis within the Sertoli cells. When we're talking about males, we know that LH will stimulate androgen synthesis within the Leydig cells. ACTH, do you guys remember what ACTH stands for? Adrenocorticotropin releasing hormone. ACTH goes to the adrenal glands and causes an increase in cortisol and sex hormones. Prolactin, what's prolactin responsible for? Prolactin, responsible for lactation, breast milk production. Where does it work? Works at the mammary glands. Works at the mammary glands. You guys remember the mammary glands? That was going to be the area within the breast. Right? We talked about the nipple, the areola, and the mammary glands. The mammary glands is going to be the site of action for prolactin. Okay. Growth hormone. Growth hormone is going to increase amino acid transport for protein synthesis. Right? We need protein synthesis in order to grow. So it's also going to increase mitotic divisions for cell growth and division. Growth hormone, it's important to know that growth hormone, once it binds to its receptor, once growth hormone binds to growth hormone receptor, there's an increase in IGF-1, insulin growth factor 1. This is important to know. So for example, if a male had a tumor over secreting growth hormone and it binds to growth hormone receptor, you would result in an increase of IGF-1. Knowing where these things are produced, that's important to know. What else is important for your examination purposes? Knowing feedback mechanisms, guys. Again, this is just I can't tell you this enough. Knowing that normally CRH comes down to the hypothalamus, from the hypothalamus, because remember it's a releasing hormone. Corticotropin releasing hormone, because it's ACTH released from the pituitary gland, and ACTH from there will go and stimulate cortisol production and sex hormones from the adrenal gland. Let's say that we have Addison's disease. Let's just say that we have low cortisol. You don't have to know what Addison's disease is, but low cortisol levels means what? Again, this is all downstream. So if cortisol is broken, what's going to back up? ACTH needs to bind to the receptor in order to increase cortisol. Cortisol is not working. ACTH is still going to continue to try to bind to itself because there's nothing shutting it off. So that would mean elevated ACTH levels. Vice versa. If the man is taking a drug that works like cortisol, how does cortisol work again? How does cortisol work? So it increases blood glucose concentrations. But why do we take cortisol for arthritic pain, or why do we get cortisone injections whenever we have, or why do we get like a cortisol analog shot, dexamethasone? Why do we get that whenever we have like pneumonia? because of its anti-inflammatory properties. Okay, so that's how cortisol works. So, for example, if you were to give somebody excess cortisol, exogenous cortisol, you would shut down the body's normal production of cortisol, which would mean ACTH levels would be low. So, again, if you're not producing cortisol, if your body's adrenal gland is messed up, ACTH levels are high. However, if you're taking exogenous cortisol, right, in the form of an injection or pills, whatever it may be, ACTH levels would be low. So those are just important points to know in order for examination purposes. It's important to know how parathyroid hormone and calcitonin work in relationship to another. Parathyroid hormone is secreted from what? Parathyroid glands, right? Parathyroid hormone is secreted from the parathyroid glands. It's going to increase calcium in the blood. Calcitonin works to lower calcium levels within the blood. For example, if you guys remember on the previous quiz, I said that a man had a parathyroid adenoma, which oversecreted parathyroid hormone, resulting in increased levels of calcium. So, which of the following would you most likely expect? And the correct answer was increased levels of calcitonin. And we reasoned that being the right answer because we said that calcitonin would increase in order to counteract the increase in calcium levels as a result of parathyroid hormone. So again, you can flip-flop that and say that if a man had a tumor producing too much calcitonin, what would the levels of calcium be? Well, they should be low. So what would you expect parathyroid hormone levels to be as a result? They would be elevated. Remember, it all comes down to this concept of homeostasis. The body is constantly trying to counteract each other in order to maintain this normalcy. And you guys know that calcitonin is stored where? The parafollicular cells, right, of the thyroid gland. Okay, just making sure we still remember that. Getting back to some other things, understanding the role of estrogen in negative feedback. I think that's important to know that GnRH will increase LH and FSH in order to increase estrogen. Remember, the follicle stimulating hormone is going to, along with LH surge triggers ovulation. We knew that. And FSH production along with LH increases estrogen levels, right? Estrogen will have a negative feedback mechanism on GnRH. So if a woman's been in menopause, like we had an example in the quiz, where she had low estrogen levels, you would expect either FSH or LH to be high. Does that make sense in terms of negative feedback? If estrogen is low because it's downstream, FSH and LH must be elevated. We've talked about how insulin is normally. What's the function of insulin? Well, first of all, where's insulin and glucagon produced? Insulin and glucagon produced from the pancreas, absolutely. And is this the endocrine or exocrine portion? Endocrine function. Where specifically, what cells did I say that were important for insulin and glucagon? Beta cells were secrete insulin. Alpha cells secrete glucagon. Good. Insulin, normal function. Lowers blood glucose. And glucagon increases blood glucose levels. Cool. So, if someone had diabetes in which they had no insulin production, type 1 diabetes, there's destruction of the beta cells, right? Beta cells normally produce insulin, and you have destruction of the beta cells. If insulin normally lowers blood glucose levels, what would you expect the blood glucose levels to be? Absolutely, they would be elevated. Great. Um, as a result of this, um, as a result of insulin not working, glucagon is going to increase because normally insulin will shut off glucagon. So glucagon levels would be elevated. Um, moving on to other things that I said were important for the male reproductive lectures, understanding the site of sperm maturation, knowing where it occurs within the epididymis, understanding the route of sperm transport, seminiferous tubules, the epididymis, the vas deferens, the ejaculatory duct, nothing, the urethra, and then the penis. Understanding that a hydrocele is due to a membrane defect within the tunica vaginalis, I think that's pretty important to know. Again, knowing the role of the spermatic cord is going to transport blood flow throughout the testes, and it's going to be responsible for um, uh, uh, blood entering the testes through the testicular artery and through the venous drainage through the pampiniform plexus is going to drain it. So if there's decreased blood flow, you know there's a problem with the spermatic cord. Um, in terms of sperm itself, knowing the head, neck, midpiece, and tail, knowing the tail is the terminal end. The mitochondria is contained where? The midpiece, absolutely. So the mitochondria is the site of ATP production. So most of the energy production within the sperm that it's being used for travel is within the midpiece. Knowing that the LH surge is responsible for ovulation, knowing the only form of contraception that is protective against HIV is going to be um, condom use. Knowing that the latter forms of birth control that we talked about in lecture, oral contraceptive pills containing both estrogen and progesterone, as well as the depot shot containing the progesterone analog, knowing that those are going to be the more reliable forms of contraception, whereas the vaginal sponge and the cervical cap are not going to be as useful. Understanding and being able to identify an ectopic pregnancy as well as where is the most common site. We said that was within the ampulla. Knowing the anatomy of the reproduction will be important. Remember, we talked about how the cervix is the area that lies between the uterus and the vagina. It's the transmission site of sperm up into the uterus, and again, it meets within the fallopian tubes in order for fertilization to occur. Understanding, let's see, what else can I give you guys? Understanding that from a uh, in terms of a reduction in the ploidy or the number of chromosomes, this occurs in both males and females from the primary to the secondary site, right? Primary spermatocyte, primary oocyte to the secondary, either sperm or oocyte. Changes from a diploid to a haploid state during meiosis. And this should be plenty enough to keep you guys maybe to ease your minds before the exam. Again, these are just a few of the things that I talked about in lecture. I hope that you found this video useful. I hope that it's helping your studies, and I hope that you guys come tomorrow prepared to um, not only show myself, but just show yourself how hard and how much you know. Look at this exam as a way to show yourself and prove to yourself how much you know, and an opportunity to really prove yourself. So, again, if I can be of any help, please feel free to reach out. I really appreciate you guys, and I'm thankful to have you guys in my class.